Hey everyone, welcome to Political Capital. Thanks so much for joining us each and every week here at the Czech News Studios in Victoria. I'm your host, Rob Shaw. Different format for this week's show. Our political panel will come up later in the podcast. Make sure you subscribe. We have a very special guest this week, and we're going to spend the show talking to her. She needs no introduction because you see her numerous times a week, including on Czech News. Provincial Health Officer Dr. Bonnie Henry joins us this week. Dr. Henry, thanks so much for being here. Thank you for your time.
Thank you for having me.
I know that right now a lot of people are talking about the travel restrictions that are about to come in. And I just wanted to say, kind of personally, it gives me a little bit of anxiety, that idea of police officers and checkpoints and asking you where you're going and determining whether you can and can't travel. And I just kind of wanted to, have you heard that from people in your life? And how do you sort of respond to that idea that, holy moly, we're at the point now in this where we have police officers at checkpoints? It's kind of a frightening image in my mind.
Well, I actually think that it is a reflection of where we are right now. We have always relied on people's best interests to make those sacrifices, to stay put. And we've seen right now that with the new variants that we have, the increased transmission, that moving around our province is dangerous and it's spreading the virus. So it is about putting in some more restrictions, making it very clear for people that you shouldn't be going between places because we've seen transmission happening in ways that we have not seen before. So that's the purpose of this. It is under the Emergency Programs Act, so that does enable people to do checkpoints, as we said. But it really is about defining those boundaries for people and making sure that we are all clear about why we need to do this right now. And it's about protecting our hospitals.
Our hospitalization rate continues to rise, but we are seeing a little bit of a bending of the curve in terms of the case count. And does that give you optimism? Are we responding in a way that might not require us to have to go through the full 5 week extension of this circuit breaker, or is that a sort of necessary, despite optimistic time signs we might be seeing?
Yeah, it's one of those things where I am really hopeful that we're going to get through this, hopefully sooner than the May long weekend. But I think we all need to be prepared for this 5 weeks being an important time, the most important time for us. We have vaccines on our side, we're immunizing people, but we're at a level right now where people and younger people are ending up in hospital. And our hospitals, as you say, are at their highest point they have ever been. And it takes time for that to move through. So the fact that we're seeing slight decreases right now is because people are doing the right thing, and that's important, and that's the direction we need to keep going. But it's going to be some weeks before we see the pressure taken off our hospitals. And I talk to my colleagues in the hospitals, and they're tired, they're discouraged, they're afraid that they're going to see more and more younger people coming in, and people in their 40s and 50s now are ending up in ICU. So this is what we need to do now to get us through this period, to take that pressure off and to save lives.
The third wave that we're in now, whether we're cresting it or coming down or at the peak of it, it looks like it really took off at spring break. And you've mentioned in the past in modeling about Whistler and the variants of concern there and some of the travel around. I think a lot of people have that question of, had we maybe put the roadblocks in earlier or considered canceling spring break or something like that, would we be in a different position now, do you think?
It's really hard to go back. It's hard to change things. We're on a daily basis looking at what was happening, but we're always playing a little bit of catch up with this virus. And we know people need it. That school break was important. Yes, we had some travel that really fed the flames of what was happening in Whistler. We were doing a lot to help decrease the transmission in that community, and we had been relatively successful. Vancouver Coastal Health and the community were working together. We were immunizing, we were doing a lot of testing, and things seemed to be coming under control. And then we had that rapid explosion. And it really is one of those things where once you reach a certain percentage of these more transmissible viruses causing infections, it becomes much, much more complicated to control. So we can't go back. We are where we are right now, and we need to take the measures that we need to do for the next few weeks because we know that they work, and we know that will take the pressure off our hospitals. And the other part that we have on our side is more and more people being immunized.
Hmm. Strikes me, I mean, you're in this perpetual balancing act that you have to, and you talk a lot about it. There are people in our society who want us to shut everything down, and you talk about the harm shutting schools does to children, both learning, emotionally, socially. Sometimes a school is their safe place.
That's true.
We talk about the economy, shutting the economy down causes job loss, causes stress and anxiety, your life savings, your work. It that perpetual balance, and the people who you must hear who always say, shut everything down for a few weeks, just close it all, make us all stay at home. But the harm that that would cause, that back and forth, how do you continue to wrap your mind around that never-ending question?
Yeah, and that has been our act, our balancing act from the very beginning. And and I've said this many times. So you can always, we never can get it exactly right. It's always too much or too little, and we see that. And the reality is, and we learned this last year when we didn't know very much about this virus, that there are many more things that must stay open to allow us to function. Whether it's grocery stores, whether it's the people who collect garbage, whether it's the people who repair the plumbing in your house. There are many, many workers who cannot do their work from home. Um, and we also know that the important fabric of our society that small retail businesses, small restaurants play in keeping us going, and how important that is, as you say, to families, to communities. So we have tried to find that balance. And one of the tools that we have used is the COVID safety plans, which makes everybody pay attention. What does it actually mean to me and my business? And where those are followed and in place, they are working. So that's why we're trying to find that balance of keeping things safely open as much as we can. And we did that with restaurants and bars and pubs for a long time until it became clear that these increased transmissibility in the indoor setting and the types of things that were happening. And part of it was us as a society not being, being at the place where we didn't want to follow those rules anymore. And we were seeing those transmission being amplified in some of those settings. So we do need to shut down things that aren't safe, but we're trying to balance that with keeping people working. And it really is a small proportion of us who have that luxury of staying home only. And there's, whether it's healthcare workers, whether it's grocery store workers, whether it's our police and fire services, um, it's important for us as to minimize the disruption in our society to keep things safely open. So that has been our focus all along, and we need to get back to that balance.
It's a balance that doesn't seem like it could be solved by charts and modeling and graphs. We see a lot of those in the news these days. Modelers, other physicians, family physicians, a lot of armchair quarterbacks, armchair provincial health officers who do their own data, do their own modeling, and then emerge to tell you what they think you should be doing. And you've dedicated the bulk of your professional life to public health, including in SARS in Toronto and in Ontario. You have a lot of experience in this area. And I wonder, do you find it frustrating to have armchair quarterbacks and other people, other physicians, other modelers coming out and telling the public you should be doing something when you're trying to handle that balance that you just talked about?
Yeah, I really appreciate a lot of the modeling, and many of the modelers that have been out there have been uh, providing advice to our teams as well. And yeah, it's hard because I understand researchers and people who deal only with numbers want those numbers to be the truth, and it is much more than that. Data never tells you what to do. It gives you a sense of what could happen. What are the important drivers? What are the things that we need to pay attention to? And that's where I find modeling incredibly valuable. And I've been a supporter of using modeling, and we've had it at the BC CDC for a long time. But it in of itself is not the answer. We need to put it in the context of what are the other things that are causing harms or causing negative impacts. What about acceptability, feasibility? Is something like that going to actually work? where does it take resources from? And who's going to be most disadvantaged about these things? So it's all a balancing of many different things. And, people say things like, well, just shut down Whistler. Well, then you have 4,000 young workers who are out of work. And where are they going to go? And what are they going to do? And there's a transient workforce. So we need to pay attention to the many other things. And one of my colleagues says, modeling is great until you put people in the mix. And it really is about our social connections and supporting people to do the right thing, making sure that people understand that, yes, this is about you too, and finding things that support both sides of the equation. It's never black and white, and it's never only the numbers that can tell us what to do.
Yeah, I mean, it's reducing the human condition and complexity down to a y-axis in a chart. Doesn't seem like it captures all of the variables that you have to look at. But I wonder from your point of view, if you watch the news or you read the paper and you see, a family physician or someone speaking up and saying, Dr. Henry should do this, it must be at some point fatiguing to have everyone second guessing you a year into this when you have much more data than everyone else.
And I'm not making these decisions alone. I have a very strong team of public health leaders, and of course we also have to recognize that there's impacts on many different parts of our lives and our communities. And so I do have strong connections with other ministries, with making sure that we are understanding the risks and things that are happening and the needs of different sectors. And so it is a very large and complex team. So yes, sometimes I think, oh, I wish they knew some of the backstory or some of the other discussions, or have they considered some of the other things. But I also know that it is important to hear those voices, because they often have a point or a piece of information that it is important for us to take into consideration. And I try not to take it personally, but yes, sometimes it's a bit wearing. But right now in particular, and I do want to say that my colleagues, whether they're epidemiologists, whether they're the family physicians, the docs that are working in the hospitals, we have had a sense of solidarity in this province that I value and appreciate. And I talk to my colleagues in critical care regularly. And the things that we have come together and done here have made a huge difference in this province. And I have tremendous respect for them.
Let me ask you about Vancouver Island. How are we doing right now? When we look at the daily case counts, they're obviously a lot smaller than Surrey, Fraser Health, Vancouver Coastal Health. And yet we do hear around the Qualicum and Oceanside area, or earlier it was around Nanaimo or Cowichan, different areas of concern. But just in a general sense, where are we at the island right now? And what are you looking at when you analyze what the island is doing and not doing?
Yeah, so we have been relatively spared on Vancouver Island, and much of that credit goes to the response of communities here and to Island Health. And Island Health is a very strong presence across the island. It's not always a perfect relationship, but they've worked very hard, and Richard Stanwyck and Kathy McNeil and the team have done an amazing job here. But I also think people on Vancouver Island, we have a relatively older population here who have been able to support each other in staying home. And I've seen lots of really great communities coming together. We've also had very high uptake of immunization, which is incredibly important, and I expect and hope that will continue. And that has been one of the things that has helped us here.
When we get to Canada Day, which is the point in which hopefully we have everyone who wants a vaccination in the province, what does that look like for us? I mean, in the United States, they open up restrictions based on your vaccination. You can take your mask off with other people, but that's based on 2 doses. We'll have most people with 1 dose by the end of June. What can we do and not do? What will it look like at that point for our province, do you think?
Yeah, I think there's a lot that we're going to get to by then. And I look a lot at the UK and see what's been happening in communities there, because we have very similar types of structures. And while I think for this next period, until we get to that critical number of adults who have protection through immunization, we're still going to have to wear masks in public places. Still going to have to keep things small. But yes, we should By the time we get into July, by the Canada Day, we've seen that this vaccine, all three vaccines that we have, so the Pfizer, the Moderna, and the AstraZeneca, after a single dose, after a period of time, it takes 2 to 3 weeks for your immune system to respond to the vaccine. And we see this in Prince Rupert. We've seen it in communities where we have had high levels of immunization in the whole community. After about 3 weeks, you start to see things drop off dramatically. But we can't let down our guard right now because there's still a lot of transmission around us. But by the time we get to July, long weekend, and that's around my birthday, so I'm thinking that that's going to be a great time. Yes, we will be able to do more things. We will be able to spend time with our family safely. We'll be able to have smaller groups together, larger groups together, particularly outside. I don't see us going back to having large crowds, large international travel and conferences, not this year probably, but we will be able to have at least 50 at a wedding. We will be able to have those coming together in a way that is safer than it is.
Even with just one shot for most people.
Even with one shot for most people, what we're seeing is that the level of protection is in the 80s, high 80s. So that is great. And we're seeing that on a community level, which doesn't mean that there's zero risk. And I think that's important, particularly right now where there's still a lot of virus being transmitted in our communities. It will not be zero risk by July 1st, but it will be much, much less. So the rate of infection, your probability of being infected, 3 weeks after you've had your vaccine, a single dose of the vaccine just plummets, but it's not zero. So we do need to be careful about that.
There are some people hoping, basketball fans in Victoria, hoping that maybe in late June, July, we could have the Olympic basketball qualifiers here with athletes from around the world. I'm trying to fit that into where we might be at in late June, early July. Does that work in your mind, or how do you approach that?
Yeah, there's been a couple of international events that, the CFL we've been talking with, and I know they're going to postpone their season until August, which I think is a wise move. Um, the basketball, there's some golfing events. So it really depends. We've seen that we can hold those types of exciting international events safely with the right planning in place and the right timing. I would be a bit concerned with June. And I know there's some discussions going on nationally and internationally about that. It's probably too early for us, given what's going on around the globe right now. And we're not alone in this wave, even in the United States, where immunization rates are quite high. There are pockets where there is still a lot of transmission. So this next few months is going to be a challenge for us, and large events like that, particularly if there's a need, or if people want to have spectators, which is of course something we all want to do, is go to. I'm a hockey fan, but to be able to go to some of these things. So I don't have an answer for that, but I would think that they should be thinking about postponing a bit longer.
What about the fall? We have some modeling that suggests maybe we don't reach the herd immunity that we want by the fall to do the things that we might want. But at the same time, you talked about the effectiveness of even just one dose. So, what are your hopes for the fall?
Yeah, so by looking at the vaccine supply that we have and the timing of things, we should have most people who wanted to have their second dose by September. And yes, there's some studies looking at children, and whether there's one where Pfizer is looking at down to age 12. And so there is likely to be a vaccine available for at least some children before school starts next year. But we're seeing around the world, and I was on calls with Israel, with the UK over the last couple of weeks, that we can get back to a sense of post-pandemic normalcy. It does not mean that COVID won't be here, but it will be more focal. So we'll be looking for hotspots and outbreaks and being able to manage those rather than the whole of society being affected as we've seen today. So I think, whether we, I think that COVID is going to be with us for a while, but how it impacts us is going to be dramatically changed from immunization. So that's what we're trying to manage now. Of course, we don't know everything. We don't we don't know if there's going to be a strain that makes vaccination less effective. So far, we've not seen that. We're testing for that really carefully, but there's many unknowns. But I do believe, looking at what's happening in other countries, that when we reach a certain point, we'll be able to manage it in a much less intrusive way and get our society back and going again.
Let me ask you a personal question. You have a lot of people who have become fans of yours over the last year, and I remember talking to you for a newspaper story at the beginning of the pandemic. You mentioned how uncomfortable that can make you feel as a natural sort of introvert speaking in public, having to take the spotlight that we shine on our officials on this, and the celebrity that you didn't ask for, but somehow comes with this job. And I wondered if you could just speak about how that feels a year into it. And I know that sometimes on social media things can be particularly mean. And someone took a picture of you at a helijet terminal recently, and I'm not going to even dignify the totally inaccurate comments that were attached to the picture, but the idea of the picture of your privacy being invaded like that, as if you're a celebrity that someone takes a picture of when you're out in public, is that how discomforting is that to you, and how have you been managing that?
Yeah, it's still, as you say, discomforting. It's still challenging, and there has been, as you say, some very pointed attacks at me personally in the last little while. And I understand that a lot of this comes from a sense of uncertainty and anxiety, and in some people that evokes this anger and lashing out. And I am the face of that, so at one sense, I recognize that and I understand that, but it is hard. It's hard, and it's hard on my family and the people I work with. But I will say as well that the vast majority of people that I connect with, that I see when I'm walking back and forth to work, which is about the only thing I do these days, are very kind and very supportive. And that is what is going to get us through this. I know that this is about human behavior and human connection, and this has been hard on everybody. Whether it's small sacrifices that we do every day, we've been asking a lot of a lot of people, and I recognize that is hard. I feel it myself, and all of us do. But I think I also believe that kindness is a superpower, and it is what will get us through this. And I try and focus on those
Hmm.
kind things that people do every day.
Well, thank you for everything that you're doing. Thank you for being here on Check and talking to Islanders. You've been very generous with your time at Check always. And it was a pleasure chatting with you. And thank you so much for being on the show.
Thank you so much. Nice to talk to you.
Thank you, everyone, for tuning in. Make sure you watch next week, Political Capital, subscribe. We will see you then.